Microsoft claims new AI system diagnoses patients with 4 times the accuracy of human doctors. Tech giant Microsoft has unveiled a powerful new artificial intelligence tool that it says can diagnose patients with 4 times the accuracy of human physicians and at significantly lower costs. The company developed the system by hiring top AI researchers, including several former Google employees, marking what CEO of Microsoft AI Mustafa Suleyman calls a real step toward medical superintelligence. The new tool was tested through an experiment designed to replicate the diagnostic process of human doctors. Microsoft used 304 case studies sourced from the New England Journal of Medicine to create what they call the sequential diagnosis benchmark. The cases were broken down step by step, mimicking the logical and methodical approach a real physician would take to arrive at a diagnosis. To tackle the benchmark, Microsoft developed a system called MAI Diagnostic Orchestrator, MAI-DxO, which works by consulting multiple leading AI models such as OpenAI's GPT, Google's Gemini, Anthropic's Claude, Meta's Llama, and xAI's Grok, in a collaborative framework that resembles a team of expert specialists working together. In testing, the MAI-DxO outperformed human doctors, achieving a diagnostic accuracy rate of 80%, compared to 20% for physicians. It also managed to cut costs by around 20%, thanks to its ability to recommend less expensive tests and procedures. This orchestration engine, multiple agents working together in a debate-style chain, is what will bring us closer to medical superintelligence, said Suleyman. Microsoft recruited several AI experts from Google to support the initiative, highlighting the intensifying competition among tech companies to secure top talent in artificial intelligence. Notably, Suleyman himself is a former Google executive with a background in AI. While AI is already used in various sectors of U.S. healthcare, such as helping radiologists interpret scans, these newer, multimodal AI models have the potential to serve as general diagnostic tools. However, their use also raises ethical and practical concerns, especially regarding bias in training data that may affect certain demographic groups disproportionately. Microsoft hasn't yet decided whether it will commercialize the technology. However, a company executive speaking on condition of anonymity suggested that the system could eventually be integrated into platforms like Bing to help users self-diagnose, or turned into tools that support or even automate parts of the clinical workflow. What you'll see in the coming years is that we're increasingly testing these systems in the real world, Suleyman said. This project adds to a growing body of research suggesting that large language models, LLMs, can play a major role in diagnosing illnesses. Both Microsoft and Google have previously published papers showing that LLMs can achieve accurate diagnoses when given access to patient health records. What sets this new research apart is its attempt to more faithfully replicate the clinical reasoning process of doctors examining symptoms, ordering tests, and performing follow-ups to reach a diagnosis. In a blog post announcing the project, Microsoft called this orchestration of multiple top-tier AI models a path toward medical superintelligence. The study also emphasizes AI's potential to reduce healthcare costs, which is particularly relevant in the United States. Our model performs incredibly well, not just in reaching a diagnosis, but doing so very economically, said Dominic King, a Microsoft vice president involved in the project. David Sontag, an MIT scientist and co-founder of AI health startup Layer Health, described the research as very exciting. He highlighted the importance of the study's rigor, noting that it mirrors real-world medical decision-making more closely than previous models. That's what makes this paper strong, he said. Still, Sontag urged caution, pointing out that the human doctors in the study were not allowed to use any supporting tools, unlike their usual clinical environments. He also noted that it's still unclear whether the AI system would actually reduce costs in practice, as doctors often consider contextual factors like a patient's pain tolerance or the availability of medical equipment elements an AI may not fully account for. This is a remarkable report because it tackles highly complex diagnostic cases, said Eric Topol, a scientist at the Scripps Research Institute. He added that the idea that AI could reduce the cost of healthcare is a relatively new and promising development. Both Topol and Sontag emphasized that before Microsoft's tool can be broadly deployed, its effectiveness must be demonstrated through a clinical trial, directly comparing the AI's performance with that of real doctors treating real patients. Only then can we get a truly rigorous cost-benefit assessment, Sontag concluded.